Dr. Chari Cohen. She's the president of the Hepatitis B Foundation. Dr. Cohen, thank you for being here with us. So our understanding now at this point is that the vote on the hepatitis B vaccine has been delayed until tomorrow. But we've been talking a lot about what a possibility, what the recommendation could really look like in terms of this vaccine. As we know, it's given to a child within 24 hours of being born. And the idea is that you test the mother during the pregnancy for hepatitis B. Tell me about some of the discussions that you're watching playing out with this.
Yeah, thank you. We have had universal recommendations for birth dose in the U.S. for 40 years, meaning every pregnant woman in the U.S. is supposed to be tested for hepatitis B. If they test positive, then their baby gets the birth dose plus an additional shot to prevent mother-to-child transmission. But every baby in the U.S. is recommended to get the birth dose, and that prevents hepatitis B infection universally. So it serves as a safety net, not only for mother-to-child transmission, but for early accidental household exposure to the hepatitis B virus.
You talked about birth dose plus shot. The idea, though, right, is that the mother, according to Dr. Sutton, would be tested during the pregnancy, not necessarily at delivery.
So, yes, the recommendation is to test all pregnant women. Operationally, though, we know that that's really difficult. So in the U.S., right now, about 16% of women are not tested during pregnancy for hepatitis B. Some women are not accessing prenatal care. Some are just not getting tested. So operationally in the U.S., it is really hard to ensure that you know the status of every pregnant person who's walking in to give birth. That's why the safety net of the birth dose is so important. You just can't know 100% of the hepatitis B status of every pregnant woman.
And quickly, for Dr. Sutton to weigh in on that, you've mentioned that not every woman has access to that kind of care or those rapid results tests.
We're also dealing with the maternity healthcare crisis within the United States. More than 30% of counties don't have a functioning OB or birthing centers. Many mothers are traveling hours to their appointments, and as was just astutely stated, at least 15% are not getting their recommended appointments, or less than 50% of recommended appointments. That leaves many mothers without access to testing, which unfortunately does nothing but increase the risk to newborn infants.
And Dr. Cohen, another thing that we've discussed here is that there might be mothers watching this play out right now, trying to make this kind of decision. What kind of conversation should they be having with their healthcare providers specifically regarding this hepatitis B vaccine?
I think the question to ask is there a reason for this change right now? What we know is we have 4 decades of safety data saying that the hepatitis B vaccine birth dose is safe and it's effective. And so I would maybe ask my healthcare provider, is there a reason that we are potentially changing this recommendation? What I can see from my perspective is there's no new safety data, that there's no necessarily scientific evidence for changing this. So I would want to focus on that.
And how is your foundation preparing for whatever information comes out tomorrow?
That's a great question. We are trying to focus on what the recommendation will be. So we've seen draft questions. We don't necessarily know what the vote actually will be, but then we have to think about the implications. So what kind of public health infrastructure do we now have to build since we are no longer going to have this safety net? What's going to happen for vaccines for children? So without the vote, we don't know if the birth dose is going to be covered by vaccines for children or CHIP. So we are going to be asking a lot of questions and then basically trying to provide support to healthcare providers, health systems, community-based organizations, providers, and patients. We are asking as many questions as we have answers for.